Secretos con los maestros. Dr. Mike Nayak.
Bienvenidos, gracias por acompañarnos. Hoy tengo el privilegio de estar con el Dr. Mike Nayak, que es uno de nuestros invitados internacionales al curso de rejuvenecimiento de este año de Face and Nose. Y pues es un honor poderle preguntar cosas. El Dr. Nayak es una persona muy importante en el mundo porque está liderando las últimas técnicas de rejuvenecimiento, pero además ha hecho un esfuerzo gigantesco de educación. Y muchos de los cirujanos cuentan con él como referente, no solamente para mejorar sus técnicas, sino para ayudarlo a solucionar problemas. Entonces, pues es un honor tenerlo. Mike, good to see you.
Sí, good to see you. Es un placer. Gracias para recibirme, pero creo que usted habla inglés mejor que yo hablo español, entonces conducimos en inglés. ¿Sí?
Oh, well, absolutely perfect. Well, Mike, this is our second day of lectures, and everybody just amazed for your lectures. Everything that you show is amazing. How do you develop your deep plane technique, and how did it change the way you do the surgery after implementing all these changes?
So the deep plane technique has been in evolution for 30 years, really, I think, between all the different surgeons over time. In the last few years, the biggest advances or biggest changes in my technique, I can't say they're my advances. They're things that we pick up from each other and learn over time. But the things that have changed most in what I do when I'm doing surgery now is better ligamentous release. I used to have the ligaments in my head as specific points on the face, but especially with the zygomatic ligament, it's more of a field of ligaments that goes all the way down zygomaticus major to the modiolus. So getting really good zygomatic ligament field release all the way down to the modiolus has really improved results. That's been the last few years. And then the last year and a half to 2 years, this preservation concept where we're entering the SMAS earlier in the dissection and leaving the overlying skin attached to the SMAS much more through a larger field of the dissection, and leaving the skin attached to the platysma for almost all of the neck has been completely the opposite of what I used to do. I used to delaminate the skin from the platysma all the way down to the last wrinkle or all the way down to the cricoid. Changed that completely, and it's made the surgery, I believe, much better results despite being less subcutaneous undermining. So that's probably been the single biggest change.
But that's great. There are a lot of surgeons that are just trying to have better results, and they are implementing the deep plane in their surgeries. But we have a lot of residents and fellows trying to do the same. So which will be your best advice for these surgeons in order to be able to do this transition safe and get the excellent results that you are getting with your surgeries?
Yeah, I think when you're first, you learn more in your first year of practice on your own than you do in your entirety of university and medical school and residency, fellowship.
That's
right?
true.
All those years put together, the first year on your own, you learn more by far. And so in that first few years of practice, you're still developing autonomy, you're still developing your reputation in the area, you're still developing the ability to manage patient personalities and deal with complications. And so I think in those first year or 2, 3 after you're just getting started, you want to only generate small problems. You don't want to generate any big problems. Even little things are hard at the beginning. You know, even elevating skin flaps will be harder for you in your first year than it is in your 10th year. Or dealing with small hematomas will be more stressful for you in your first year than it is in your 10th year. And so what I would say is early in your career, focus on things that are easy to accomplish. You know, a smash plication facelift will get you 70-80% of the result of a deep plane facelift with less stress and less anxiety. And master those things. Even if you're trained in deep plane, it's not a bad idea to start with something easier. I trained in deep plane facelifts in my first year or 2 out of practice. I didn't do any. I did mass plications and first string max type facelifts. But I developed happy patients, no major complications, good reputation in the area. And then I entered the deep plane, but I didn't do the deep plane extended dissection. I was, maybe raising a couple centimeters, raising the major ligaments, freeing the major ligaments. And then I added the deep neck work. Then I added the more extended dissections. So, just because you train to the race car driver doesn't mean the first time you drive, you should drive in a Grand Prix race. First few times you drive around the neighborhood, and then eventually graduate to Grand Prix.
It sounds incredibly wise. And I think we should just spread this message that you have to start simple and getting the things a little bit more complex with your training and with your time. I have another question for you, Mike. Everybody likes you, everybody loves you, because besides your skills as a surgeon, you always are pursuing the education of the other people. So you have this amazing Telegram group, and or your lectures, you try to give all the information for the younger surgeons. Tell me, how do you develop this passion for the education and to improve the other surgeons' skills?
That's a good question. If I were not a doctor, I'd be a teacher. I think if I had or maybe a cook. I like to cook too. But the reality is, we are all here because of something that other people have invested in us, right? So every one of us has had maybe 30 teachers in our primary school, and maybe 30 more in university, and maybe 30 more in residency. So minimum 100 people have invested in you to get you where you are, and there's no way you can ever pay them back, and they don't want anything from you. So the only way you can really value what people have invested in you and instilled in you is to be that for somebody else. They pay it forward, right? And so first, it's not like it's torture for me. It's fun for me, and it's rewarding. But then two, it's kind of a responsibility. It shouldn't end with you. All the things that people have done to get you where your opportunity are the same things you should be doing for people going forward.
So that's amazing. I just admired this from you. And my last question is a little bit more difficult. Is try to see the future and try to. I would like to ask you, how do you imagine the future of the rejuvenation in the face, and how will it change in the years that are coming? And more than that, if you can add at the end of your answer a little bit of insight with artificial intelligence and how it can change the life of our practice as surgeons.
Yeah, so it's hard to see major changes ahead of time. They're by definition, quantum changes are by definition not incremental. They happen all at once. I think what I think it's going to be the next most important things will be less technique driven, more science driven. So right now, if we have a patient that has poor tissue quality and maybe the weak tissues or unhealthy tissues or fibrotic tissues from too aggressive devices or injections or whatever, we're at a strong limitation. There's nothing much I can do to improve someone who has very, very bad tissue. During the surgery, they're going to have less outcome, but lower outcome. So maybe some kind of regenerative medicine where we can identify bad tissue quality and do something before the surgery to improve their day of surgery. Have better tissues, better planes. I think it's going to be important with all the minimally invasive procedures that are happening and injections that are happening, that we have good ways of predicting who's going to be a problem in the operating room. Because some people have biostimulators and you operate, they're fine, no problems. Some people have biostimulators and you can't separate the planes, and it's a disaster. So I think that's going to be important. So I don't know how these things are happening, but these are things that I want. I want to be able to improve the tissue quality ahead of time. I want to be able to identify which patients that have had minimally invasive treatments are still safe to operate on. So they want to know, am I still a good candidate? Or which ones are going to be maybe too difficult? And then finally, post-operatively, things that would truly impact the healing course. Like right now, I tell people, you have surgery, it's going to take 2 or 3 weeks to be good looking. It's going to take 3 months to be camera ready. It's going to take a year to have final results. And I don't care how much you want to spend. I don't care how important you are. These are the timelines. Similarly to if you get pregnant, it's going to take 9 months to have a healthy baby. The Queen of England can't have a healthy baby in 3 months. It doesn't happen. But maybe there is something, maybe. So I think these are the opportunities for advancement. As far as AI, I think it'll, in our field, I think its biggest application will be in our offices, improving the administrative and technical sides of things. I don't think AI is going to replace what you and I do in the operating room anytime soon, because it's still so manual and still so dexterous, which also then requires the artistic skill and the moment-to-moment judgment, and also requires our ability to connect with patients emotionally.
That's true.
So I think you and I, it's not going to impact very much, but I think from a administrative standpoint, a technical standpoint, maybe record keeping, all the things that happen around the surgery, I think I'm hopeful that it'll take some of that burden down, staff.
Okay. Well, one last question. Tell us something about how are you feeling this course? Have you enjoyed this course?
Fantastic. Yeah.
This kind of things that we do in order to prepare the other surgeons, and you are the main character of this course. So
yeah, you and the other organizers have done such a wonderful job. The pace of the course is good. The speakers have enough time to actually teach, which I think is, sometimes the course has 50 speakers with 10 minutes each. That's not effective. So, you've given the speakers enough time to really teach. The structure is good, upper face, middle face, face, neck, it's thought out, it's well laid out. The physical plan's fantastic. The social event last night was incredible. So yeah, I think it's been a really good course.
Okay. Thank you so much, Mike. Well, this is why it's so important to have that kind of main surgeons of the world with us in these kind of courses, because we can learn a lot, not just the way they do the surgeries, but the way they think about the world and the world of education, and how can together improve the preparation of the people around the world. So Mike, thank you again to be here. I'm so proud. I'm so happy to have you here.
It was my pleasure.
Muchas gracias.
De nada.